My name is Dr. Naim Khan. I'm one of the acute medical consultants here in East Surrey Hospital. We're one of 8 acute medical consultants who help run the medical take. I guess the medical take is our way of managing patients that have been referred to us from many places, mostly from A&E and general practice, but some also from other hospitals and sort of sometimes from other specialties as well. Our acute medical take runs very well because it starts with a very important meeting at the beginning of the day, and that's called a safety huddle, which is done in the acute medical department in a room and the entrance to the acute medical department. So here at East Surrey Hospital at 9 o'clock, the day shift starts with 2 medical SHOs, 2 house officers, 1 registrar as part of the medical take. You'll get support from the acute medical team who will contribute various numbers to the take just to help bolster the take. Generally the doctors that start at 9 o'clock will finish at 9:30 in the evening, 9:30 at night. At 4 o'clock in the afternoon, a different shift starts called the Twilight shift, which is usually composed of SHOs and a house officer, and they usually run through till midnight. So that's a very useful addition to the take when things are getting really busy. The night shift starts at 9 o'clock with another safety handover, and that runs through till 9 o'clock the next morning. East Surrey Hospital has a very straight layout. It's 2 stories starting at the west entrance just off to my right here. And as you walk through, you're met with the A&E department on your left, which is just behind me. And we will go through there to just show you a little bit around, and I'll show you where the acute medical department is as well. As you come through the double doors of the emergency department, you're met with CDU first on your right. As you come further along, you'll see the majors department, and if you were to carry on down the corridor and to your left, you'll meet the resuscitation department.
So slightly farther down the corridor and on your right hand side is the acute medical unit, and this is where you'll start your day off on most of your shifts. So just over there on your right hand side in consulting room B is where the acute safety huddle happens at 9 o'clock every morning. Slightly farther down here, and it doesn't really matter which way you go round this corridor, there's one to the left and one to the right, you're going to end up at the doctor's office in the acute medical unit.
My name's Mert Surakaya. I'm one of the FY1s here at East Surrey Hospital. A typical on-call day for an F1 would begin with picking up the on-call bleep, of which there are 2. There is a 703 bleep and a 704. You would pick this bleep up either from the AMU office or from the night F1. You'd get this bleep and go to the safety huddle, which happens at 9 o'clock in the AMU clinic room. After this safety huddle, you would go to your ward, your usual ward, and do your normal day job up until 12:30. You should probably get some lunch at 12 and then go to do your on-call shift from 12:30 to around 5 usually. So from 12:30 to 5 you would be clerking patients from the take list, which is available on the patient tracking system called PTS. You would normally pick the next patient and clerk them in. Once you've clerked in a patient, you would initiate the management you thought was appropriate at that time. If you were struggling, you may ask the registrar for some advice. You would then get a consultant to post-take the patient with you. By that, it means that the consultant would see the patient with you and come up with a plan for the patient. You should aim to post-take your patients before 5 o'clock, because at 5 o'clock the ward teams would go home, and the nurses from the ward may start bleeping you for jobs that need to be done. From 5 o'clock till 9 o'clock, you would be on the ward doing what's called ward cover. So you would go and see unwell patients on the ward, or perform the jobs for the ward which need to be done. And at 9 o'clock, you would go back to the handover meeting, which is in AMU, and hand over any jobs that need to be done for the night. And the night F1 would do those jobs.
My name's Brogan Salins, and I'm a core medical trainee at East Surrey Hospital. So generally I aim to get to work at around sort of 8:45 in order to relieve the 702 or 701 SHO from their bleep and from their jobs that they may have had. And then I generally attend the 9 a.m. emergency huddle. This is sort of a huddle that is held by the critical care team and delegates sort of jobs within a cardiac arrest or emergency situation. After the emergency huddle, I then go back to my ward and go on a ward round or see patients. And this usually happens till about 12 a.m., at which point I would take my lunch break and then at around 12:30 make my way down to the acute medical unit. I usually like to liaise with the Oncall registrar 700 who might be in the acute medical unit to see if there's any very unwell patients that the registrar would like me to see first. Or I could have a look on the patient tracking system, PTS system, to see if there's a very unwell patient that might need to be clocked in perhaps by a more senior doctor or SHO rather than an F1 or F2. And then generally I would continue to clerk patients from 12:30 until about 9 p.m, making sure that any unwell patients were post-taked or seen or reviewed by a more senior doctor like my registrar or possibly a consultant. The consultants do generally go round in the evenings and they may see unwell patients, but it's important to make sure that if there is a patient you've seen that you would desperately like to be reviewed by a more senior doctor, that this occurs. At 9 p.m. there's generally a meeting within the AMU office, and this meeting is quite a large meeting with a number of doctors who are obviously leaving shift and coming on to shift. And then after that I get to go home at 9:30 p.m. after the meeting is over.
During a typical night shift, you would come in for 9 for the handover meeting. The patients from the day take would be usually discussed, and any important things would be handed over to be done. The jobs for the F1 are usually handed over from the day F1s, and these may be important things that need to be done that weren't able to be done during the day. So it's really important to keep a clear list of these jobs, and you may pick up either the 703 or 704 bleep for the night shift, but it's important to call the switchboard and link these two bleeps together, because nurses may not know which bleep to call. If a nurse was to call 704 or 703, the bleep that it was linked onto would get a call. One of the most important things is to stay very organised and keep a very clear list. And the bleep may go off very often, but I think a good tip is to keep a list of all of the bleeps that you get and try to prioritise them based on clinical urgency. I've found that there's always support for you when you need it. You can call either the on-call SHO, and these are 702 or 701. And if you need some more senior help, you can call the registrar at night, which is 700. And the people are always happy to help if you need any help. Another source of help is the critical care outreach team, who are ITU nurses who review patients on the wards. So if you have a question, you may be able to ask them.
The night shift, I come in at around 9 p.m. and I then take the bleep from the 701 or 702. And then we all sit down in the AMU office and go through the patient tracking system and have a look at all the patients that firstly have been clocked during the day. And generally it's a good idea to go through each patient and see if there are any sort of management plans that have been made or anything that needs to be anyone that needs to be reviewed overnight. And then we go onto the PTS system and see the patients that have not been seen yet and often the registrar will hand over any patients that she feels need to be seen more urgently. And then usually the SHOs will pair off and see the severely unwell patients first. And then during the night, it sometimes gets rather lonely within the hospital, being only sort of 3 SHOs and registrar seeing patients, and obviously the F1 on the ward. And it's just important to make sure that you always touch base with your registrar at all times, particularly to see if they are managing with all the phone calls that they're receiving, and whether there's a sick patient that they want you to have a look at overnight, or and also to touch base with the F1, which I sometimes routinely do, just to make sure that they are coping on the wards during the night time. And then obviously clerking patients that come up on the PTS. So it's important to refresh the PTS and have a look all the time to ensure that you're staying on top of the acute take. It's important to make sure that when you are clerking a patient in the early hours of the morning, particularly at 7 a.m. or 6 or 7 a.m., that you click that they've been completed prior to the 8 o'clock post-take ward round, because if you sort of see a patient between 7:30 and 8:30, sometimes these patients will not then come up on the post-take ward round, and then may not be seen by a consultant the next day, and this is particularly important on the weekends.
One final shift covered by the F1s and the SHOs is a twilight shift, which is from 4 p.m. until midnight. And during that shift, your job is just to clerk patients. So during the week, there will be 2 SHOs and 1 F1 on this shift, and then at weekends, it's just 2 SHOs on this shift. It's helpful when you turn up for your twilight shift, go to the AMU office, try and find the on-call registrar on 700, and again just find out if there's any patients in particular they want you to see, and also just to let them know you're here and who you are, and then get on with clerking the patients. In the evening you should try and post-take your patients if possible. If you don't manage to post-take them, make sure that all the jobs are done before you leave at midnight, and if there's any jobs that need to be handed over or any patients that you're particularly concerned about, speak to the on-call team for the night, either the SHOs or the registrars, just to let them know about the patient, what the situation is and what it is you're concerned about or what needs doing for them.
So as an F1, the weekend ward cover on-call shift would begin with you coming in at 9 o'clock, and again going to the safety huddle at 9 in the AMU office. You would pick up the bleep 703 or 704, and depending on which bleep you picked up, you would either accompany the post-take consultant on the over 75 ward round or the under 75 ward round. This would involve reviewing the patients that have come in overnight, who would need to be seen by a consultant. And this ward round would usually proceed up until about midday. In this time, between 9 and when you finish your ward round, you're expected to link your bleep onto the on-call SHO bleep, so you will not be getting bleeped from the ward during this time, to allow you to complete your ward round. The important thing about the ward round is to keep a clear list of jobs that need to be done, and you will complete these jobs after the ward round's finished. When you've finished your jobs from the ward round, there is a list of jobs on the patient tracker system which the weekday team have added. So once you've completed your post-take jobs, you may begin going through the patient tracker system and looking at these jobs to complete. Usually you would split the wards between you, and there are 2 F1s and 2 SHOs to do this with. So you would meet up and split the wards, and then you would proceed to completing these jobs based on the location.
Generally, when I put my name down to see a new patient, I will write my name up alongside the patient on the PTS system, as well as my bleep number if the registrar would like to contact me to see how I'm doing. And then I'll have a look on our Cerner and see if there's any new blood results or chest x-rays or any old notes that I can find on the system. And then after having looked at that, I will see where the patient is in the hospital on the FirstNet computer system. And then from there, I will go and find the patient, clock the patient in entirety, taking obviously a full history and examination. And then after that, if I have any questions, I'll sort of ask my registrar if there's anything I'm worried about. And then after that, I will click completed on the PTS system to say that I've completed the patient and that I'm happy with moving forward to the next patient on the take list.
I'm Lisa McPherson, one of the core medical trainees at East Surrey Hospital, and I'm going to talk about the SHO roles at the weekend. There's 2 roles for SHOs at the weekend. The most simple is the one that starts from 9 a.m. and works till 9:30 p.m. When they arrive at 9 a.m, they will collect their bleep, which is 701 or 702, go to the safety huddle, and then their job for the day is to clerk all the new patients appearing on the PTS list. There will be a consultant coming around to post-take the new patients at sort of 3-4 o'clock in the afternoon. Before that point, if you have any concerns about your patients, speak to the registrar on 700, and then try and get your as many patients as you can post-take by the post-take consultant in the afternoon. You'll continue that until 9 o'clock when there's then the evening sort of, again, safety huddle before you will then be released at 9:30 to go home. The other role for the SHO at the weekend is working from 8 a.m. till 8 p.m. When we come in at 8 o'clock, we will pick up the post-take ward round list for the cardiology and the gastroenterology patients that have been seen over the last 24 hours, and these should be printed out by the night SHO team, ready for us in the morning, and then we will meet with either the gastroenterology or the cardiology consultant. We will be carrying bleeps 328 and 329, and until between 9 o'clock and 12 o'clock we will also have either 703 or 704 linked to our bleep, so we'll be picking up extra bleeps from the wards during that time. Hopefully the post-take ward round doesn't last all morning, and as soon as it finishes we'll then do the jobs that have accumulated from that post-take ward round and then check on PTS to see what jobs the ward teams during the week have felt that we needed to do over the weekend. And as I said, during this time we will also be getting bleeps from the wards, so there may be sick patients on the wards that nursing staff want us to review. Once the 2 ward cover SHOs and the 2 F1s, so on 703 and 704, have finished their post-take ward rounds, it's good for the 4 of them to meet up and sort of distribute the work. It ideally should be that one of the SHOs and one of the F1s covers the over 75 wards, and one of the F1s and one of the SHOs covers the under 75 wards, but people tend to do what they feel is best for them. On PTS, as I said, there's a long list of jobs such as chasing bloods, prescribing fluids, reviewing antibiotics that the ward team felt needed to be done on Saturday or Sunday, and those jobs will be distributed amongst the 4 ward cover team. There is also a ward cover registrar who will also have a list of jobs to do on the wards, and they are our sort of point of call if we've got any problems, and they can be contacted on bleep 251 at any point. It's quite handy to touch base with them at times as well to make sure we're not sort of reproducing work.
It can be quite daunting starting in a new hospital on a busy medical take, but we're here to support you. So during the day there will be consultants in acute medicine helping you, and as the day goes on you'll find there are more and more consultants around that you can talk to about anything that you're worried about, sort of patients or otherwise. There's also the registrars that are there for the acute take as well as the ward. And at night, if you'll have a registrar supporting you and a consultant who will be at the end of the phone if you need anything that is a difficult decision to make. So you won't be alone, you'll be very well supported. Well, here at East Surrey we look forward to welcoming you and working with you, and we'll support you in any way that you need.